In this chapter, let's learn about chronic complications of diabetes. All forms of diabetes, both inherited and acquired, are characterized by hyperglycemia, a relative or absolute lack of insulin, and the development of diabetes-specific microvascular disease in the retina, renal glomerulus, and the peripheral nerve. Diabetes is also associated with accelerated atherosclerotic microvascular disease affecting arteries and supply the heart, brain, and the lower extremities. Pathologically, this condition resembles microvascular disease in non-diabetic patients, but it is more extensive and progressive more rapidly. Chronic kidney disease is diagnosed by the persistent presence of elevated urinary albumin excretion, low eGFR, or other manifestation of kidney damage. In this section, the focus will be on CKD attributed to diabetes, which occurs in 20 to 40% of patients with diabetes. CKD typically develops after diabetes duration of 10 years in type 1 diabetes, but may be present at diagnosis of type 2. CKD can progress to end-stage renal disease and is the leading cause of ESRD in China. In addition, among people with type 1 or type 2, the presence of CKD markedly increases CV risk and health care costs. Screening for albuminuria can be most easily performed by urinary albumin to creatinine ratio in a random spot urine collection. Normal UACR is defined as less than 30, and high urinary albumin excretion is defined as more than 30. Microalbuminuria is defined as UACR 30 to 300. Microalbuminuria is defined as UACR over 300. Diabetic retinopathy is a high specific vascular complication of both type 1 and type 2 diabetes, with prevalence strongly related to both the duration of diabetes and the level of glycemic control. Diabetic retinopathy is the most frequent cause of new cases of blindness among adults aged 20 to 74 years in developed countries. Patients with type 2 diabetes should have an initial dilated and comprehensive eye examination at the time of the diabetes diagnosis. If there is no evidence of retinopathy for one or more annual eye exams and glycemia is well controlled, then screening every 1 to 2 years may be considered. If any level of diabetic retinopathy is present, subsequent dilated retinal examinations should be repeated at least annually. If retinopathy is progressing or sight-threatening, then examinations will be required more frequently. Diabetic neuropathies refer to the presence of symptoms and/or signs of the peripheral nerve dysfunction in people with diabetes after the exclusion of other causes. The diabetic neuropathies are a heterogeneous group of disorders with diverse clinical manifestations. The early recognition and appropriate management of neuropathy in the patients with diabetes is very important. The most common early symptoms are induced by the involvement of small fibers and include pain and unpleasant sensations of burning and tickling. The involvement of large fibers may cause numbness and loss of protective sensations, LOPS. LOPS indicates the presence of distal sensory motor polyneuropathy and is a risk factor of diabetic foot ulceration. The most common symptoms is mainly in the toes, feet, or legs. All patients should be assessed for diabetic peripheral neuropathy starting at the diagnosis of type 2 diabetes and 5 years after the diagnosis of type 1, and at least annually thereafter. The symptoms and the signs of autonomic neuropathy should be elicited carefully during the history and physical examination. Major clinical manifestations of diabetic autonomic neuropathy include hypoglycemia unwareness, resting tachycardia, orthostatic hypotension, gastroparesis, constipation, diarrhea, and so on. Foot ulcers and amputation, which are consequences of diabetic neuropathy and/or peripheral arterial diseases, are common and represent major causes of morbidity and mortality in people with diabetes. So for foot care, perform a comprehensive foot evaluation at least annually to identify risk factors for ulcers and amputations. Patients with evidence of sensory loss or prior ulceration or amputation should have their feet inspected at every visit. Obtain a prior history of ulceration, amputation, tracheal foot, angioplasty or vascular surgery, cigarette smoking, retinopathy, and renal disease. Assess current symptoms of neuropathy like pain, burning, numbness, and vascular diseases. The examination should include inspection of the skin, assessment of foot deformities, neurologic assessments, and vascular assessments including pulses in the legs and the feet. Patients with symptoms of claudication or decreased or absent pedal pulses should be referred for ankle bronchial index and for further vascular assessment as appropriate. ASCVD defined as coronary heart disease, cerebral vascular disease, or peripheral arterial disease presumed to be of atherosclerotic origin. It's the leading cause of morbidity and mortality for individuals with diabetes. Unlike microvascular disease, which occurs only in patients with diabetes mellitus, microvascular disease is thought to broadly resemble that found in subjects without diabetes, although even this general pathologic finding remains inconclusively established. However, subjects with diabetes have more rapidly progressive and extensive CVD, with a greater incidence of multi-vessel disease and a greater number of diseased vessel segments than non-diabetic persons. Common conditions coexisting with type 2 diabetes, such as hypertension and dyslipidemia, are all clear risk factors of ASCVD, and the diabetes itself confers independent risk. Numerous studies have shown that the efficacy of controlling individual cardiovascular risk factors in preventing or slowing ASCVD in people with diabetes. Furthermore, large benefits are seen when multiple cardiovascular risk factors are addressed simultaneously. Therefore, the management of microvascular complications needs to control multiple risk factors, such as blood sugar, blood lipids, blood pressure, antiplatelet drug application, smoking cessations, and other treatments. Okay, in this chapter, we have learned the chronic complications of diabetes. Up to now, we have completed the courses of diabetes, and thank you for listening.